Stand by SOT1.
Standing.
10 seconds. Ready, rolling. Ready, SOT1.
Ready.
In 4, 3, 2, 1. Roll in.
From legendary Uncle Studios in beautiful Southern California, welcome to another edition of Work Comp Matters, the central location for you employees, you employers, and of course, we haven't forgotten about you damn independent contractors. And now, here's this week's edition of Work Comp Matters.
Good afternoon, everybody from beautiful Southern California. It is 12 noon straight up, December 20th, 2021, the work week before Christmas weekend. Thank you for joining another edition of Work Comp Matters. We are, of course, brought to you by, sponsored by My Empire, mancavepodcasting.com. If you want to access over 600 podcasts, they're completely free, no obligation. They're available 24/7. All you have to do is go on to mancavepodcasting.com, give a click, and you are in. We are there for you 24/7, completely free. And if you want to do your own podcast anywhere in the world, all you need is a smartphone or a computer. For a small chunk of change, we will manage, produce, direct, stream live your podcast on social media and get it into the cloud forever, all for one low fee. And an example of that, of course, is Work Comp Matters. I want to thank very much Scott Walden of legendary Uncle Studio for helping me get the show on the air, as well as my partner for many years, Mr. John Scalia, out in Munich, Germany. Stories in the news today for you employees, you employers, and of course, we haven't forgotten about you damn independent contractors. Covered California insurance deals range from no-brainer to sticker shock. California braces for an onslaught of Omicron cases. Health emergency declared in San Francisco's Tenderloin neighborhood. San Diego Union Tribune, UCSD fears COVID-19 surge could hit San Diego by New Year's. Dr. Fauci says Omicron variant is just raging around the world. From CBS News, President Biden to deliver address on COVID Omicron variant Tuesday, tomorrow. From The Hill, NIH Director, holiday travel for unvaccinated, not a great idea. From the Orange County Register, first Orange County Omicron case found in an adult returning from domestic travel, and other stories that we believe interest you employees, you employers, and independent contractors. I want to take the first story of the day. This is California braces for the onslaught of Omicron cases, with officials yesterday painting a grim picture of a winter in which the Omicron variant spreads with devastating speed. California hospitals are trying to do what they can to prepare for the weeks and months ahead. The limiting factor for many hospitals will not be beds, but people to staff them, said Nancy Jin, Regional Medical Director of Quality for Kaiser Permanente, Southern California. Now, I want to talk about this Omicron variant, okay? We've all heard how this is spreading like wildfire. We've heard in the news that everybody's getting it, both here in the California, in the United States, and around the world. And presumably there are also multiple variants of the Omicron. And of course, we have a story here about Dr. Fauci talking about the Omicron spreading like wildfire. What concerns me is that we don't really have any hospitalizations or deaths due to the Omicron. What we hear is we don't know. Well, we know it's spreading like wildfire. And we also know that there have been, at least from, and I could be wrong, no recorded hospitalizations and or deaths due to Omicron. Now, we do know that hospitalizations are up and deaths are up, but that is due to Delta. And by the way, my understanding is that all of those hospitalizations and all of those deaths are by people that are not vaccinated. So if you're not vaccinated, you're an idiot. What can I tell you? But what concerns me, and then I'll go to John for his comment. I know he's going to want to comment, is that we're getting all this news about the Omicron is spreading, the watch out for the Omicron, and basketball games, football games, pushed back, canceled. But we're not hearing on the news that although it's spreading like wildfire, there's no hospitalizations or death to it. All the deaths, all the hospitalizations that I've heard of are due to Delta and by those that are not vaccinated. So I want to go to my partner. He is he completely is the devil's advocate, gives me the other side. He tells me when I am coming out of left field, but also he admits when I'm right. Ladies and gentlemen, Mr. John Scalia.
Yeah, Steve. Well, I think you're partially right, and I think you're partially wrong. The wrong part is that I know for a fact that Boris Johnson, who's not one of my favorite people, the Prime Minister of England, specifically said that a couple of days ago they had their first death as a result of Omicron. So at least in the United Kingdom, there's been one death already attributed to Omicron. And I think there have been a few others, but I'm not sure. You're right. The overwhelming majority of people get hospitalized from the Delta variant, but there are hospitalizations, I believe, from Omicron because hospitalizations, certainly in Europe, are spiking all over, and the beds are jamming up, and there's travel is being restricted, which may or may not do anything. But again, you're right about the fact that, it's getting tiring hearing these guys saying, well, we know it's there, but we don't know much else. Okay. At least they're being honest about that. But if you don't know much else, I guess the question is, why don't you just shut up until you do? But I mean, it would be like a lawyer telling his client, I don't really know what's going to happen in your case, but here's what I think. Well, if you don't know what's going to happen, you probably shouldn't be thinking. So yeah, I agree with you. I think it's aggravating. I think they're just trying to be honest and transparent in admitting that they don't know. But I think it is serious. I mean, it is definitely going to be the number one brand of COVID. And in some instances, it will be fatal, although apparently not nearly as much. And it is resulting in hospitalizations. And you're right, the overwhelming number of people, I don't know if they're all unvaccinated, but without a doubt, the overwhelming number of people being hospitalized are the unvaccinated. So what I would say is, if I were Politico and I'd be grading your comments, I would say mostly true, but some inaccuracies. So
on the John Scalia political meter, I get like a 7 minus.
Yeah, 7+.
I'll take a 7+. I'll take a 7+. In closing, I just wish that, okay, you want to say that Omicron is spreading and it's going like wildfire and we just don't know. And hospitalizations are up, deaths are going up. But why not simply add on to that? Because it's true that, okay, John, fine, one death. 95 to 99% of the hospitalizations and death are due to Delta and are not due to Omicron. Now, we may not know.
If I can interrupt, I think, you're right on the death statistics. Yeah. But I think you're wrong on the hospitalizations because the hospitalizations are just increasing by staggering amounts in Europe. And my understanding is most of those are due to Omicron.
Really? Okay. Well, tell you what, John, I'm going to give you a homework assignment. I'm going to give you a homework assignment for Friday's show. I want you to do a little bit of research, use your regular journalistic integrity. I trust you, and find out if the hospitalization, what the percentage of hospitalizations and death in Germany or in Europe are due to Delta and what are due to Omicron? That's your homework, John, for the week.
Okay, I can do that.
All right, there we go. And now we will continue on with the news. John Scalia was a practicing 40 to 45-year workers' compensation employment labor law attorney in beautiful Southern California. But about 7 to 8 years ago, he decided not to just talk about the socialist life, but go live the socialist life. So he retired, semi-retired. I still don't know what it is. Retired from practicing law, but he's currently working on his fourth book. He's out in Munich, Germany, putting his money where his mouth is. Mr. John Scalia.
This is from Covered California. Covered California's insurance deals range from no-brainer to sticker shock. If you purchase your own health insurance, it's time to choose your coverage for 2022. If you buy it through Covered California, the chances are better than ever that you will get a big discount on your monthly premium or pay no premium at all. Many middle-class families who previously paid full fare for their health plans got financial assistance this year through the American Rescue Plan, a law that significantly expanded federal tax credits that reduce the premiums consumers pay. And it goes on to say, and listen to this, it says, if you're a family of four earning less than $40,000 a year, you get free health insurance. Well, $40,000 a year is way below the poverty line in California. And for a family of four, it's pretty absurd. I mean, it was a good income when I earned about that much money 50 years ago, more than 50 years ago, probably. But it's ridiculous. Okay, so those people get it free. But listen to this. He's talking about somebody who's going off and was getting help in the federal plan in 2022, and he was paying $344 a month. And now that person is going to have a premium of $1,269 a month. And again, this comes under the old "I told you so" file. You've heard me talk about socialized medicine in Europe and the fact that the average European out of his income pays about $5,000 a year for the socialized full coverage. And yet these are the figures that are still going on in what is arguably the richest and certainly the most powerful country on earth. And as I've said time and time again, I personally think it's disgraceful. Steve.
Thank you, John. This is from the San Diego Tribune. If our toilets are any indication, San Diego County may be in for a sharp spike in coronavirus cases soon. On Saturday, University of California, San Diego officials warned that samples from the Point Loma wastewater treatment plant, which process flush waste from 2 out of every 3 San Diegans, has the highest level of the coronavirus that the university has seen since February. Both the Delta and the Omicron variants of the virus are fueling this rise. John.
Is that where the statement comes from? It's a shitty job, but somebody has to do it?
Oh, John, your play on words just makes my Monday.
SF Mayor Breed, that's really her name, declares state of emergency in Tenderloin. A makeshift tent encampment on Ellis Street. They have a picture of it in San Francisco Tenderloin neighborhood in 2019. San Francisco Mayor London Breed on Friday declared a state of emergency in the beleaguered Tenderloin neighborhood. A move, she said, will allow the city to avoid bureaucratic red tape and efforts to address both the drug overdose crisis and acts of violence and crime in the neighborhood. Now, let me give you some background on this. I mean, I grew up in San Francisco, okay? And I'm 75 years old. And when I was growing up and I was 12 or 13, the Tenderloin was a bad area. And guess what? It's now 60 years later, and the Tenderloin is a bad area. Again, I say, how does this happen in the richest country in the world? The article goes on. Too many people are dying in this city. Too many people are sprawled over our streets, Breed said at a press conference at City Hall on Friday afternoon. There are a number of things the city is going to do to address safety. And part of that is a police response. But the other part is being aggressive about getting people into services and support and not allowing. Last year, 712 people died in San Francisco of drug overdoses, compared with 257 who died of COVID-19. So there you have the scale of the problem. 30 times as many people are dying from drugs. The article goes on, it's fairly long, and at the end, there's a person who works on solving the homeless problem. Her name is Jennifer Friedenbach or something like that. I can't scroll down fast enough. Anyway, it is Friedenbach. There's nothing new, Friedenbach said, of Breed's strategy. This is not changing course. This is literally doing a tried and failed policy that's already failed. And she's talking about sending more cops into the area for a social problem. And I would point out that London Breed, the mayor, is a liberal Democrat. So there you've got it. And nobody seems to, it's been 60 years now, and the same problem exists. It's perhaps worse now. Oh, believe me, it wasn't very good when I was growing up. And everybody in San Francisco knew that was a neighborhood to avoid. Steve.
And by the way, London Breed came out a couple of days ago or last weekend and asked to refund the police because the organized crime and organized theft has gotten way out of control. You're dialed into Work Comp Matters. We're brought to you by mancavepodcasting.com. If you want to do your own podcast where all you have to do is talk anywhere in the world, all you need is a smartphone or a computer. We will produce, we will direct, we will manage, stream live your podcast. The content is completely yours. Get it into the cloud forever, all for one low fee. And if you just want to listen, we've got over 600 shows in the tank, completely free, no obligation, available to you 24/7. From the Associated Press, continuing with the news, Dr. Fauci says the Omicron variant is, quote, just raging around the world. The COVID-19 Omicron variant is just raging around the world. The White House's top medical advisor said yesterday, as President Joe Biden prepares to issue a stark warning of what the winter will look like for unvaccinated Americans. Dr. Anthony Fauci, the country's leading infectious disease expert, told NBC Meet the Press that the real problem for the United States hospital system is that we have so many people in this country who are eligible to be vaccinated who have not yet been vaccinated. I want to comment on that briefly. The numbers as of a couple of days ago indicate that in California, about 65% of the population is fully vaccinated. In the United States, about 60% of the population is fully vaccinated. However, in California and the United States, about 20% of the population is boosted. Those are the numbers. Take them as you will. John.
Yeah, by the way, I get my boost on Thursday. The first year of COVID, farm and construction workers among those most likely to die. This again comes under the I told you so list of articles that I'm reading today. What a shock. People in low income brackets die as a result of disease and environment more than people who are in high income groups. This is the fifth story in our reporting series, year one, COVID-19's death toll. Robert Mejia was recently visited by a certain kind of grief. It was both the absence and presence of his father. It goes on, talks about, okay, it's going to get very personal, but here, let's get to the stats here. One, COVID-19 is far more deadly for elders, but more than 1,000 people who died were 65 or younger. That's out of 4,000 death certificates that they looked at. Voice of San Diego categorized the professions of each of those working age San Diegans according to US Census industry codes. The analysis reveals that COVID ripped through some working class professions, even as white collar professionals tended to be more isolated. Agricultural workers were hit harder than any other group. Their share of the death toll was 612% higher than their share of San Diego County's workers. A wide-ranging census category, which encompasses security guards, custodians, and clerical workers, experienced the second most disparate death rate. Construction workers had the third highest death rate and represented the single highest number of deaths. Out of 1,204 working-age people who died, 132 worked in construction. It's sad, it's an unfortunate thing, said Kelvin Barrios, Community Engagement Director of the Laborers Local Union 89, which represents nearly 4,000 construction workers in San Diego. Barrios, however, was quick to point out that no working age members of Local 89 died from COVID-19. And I think the reason for that's pretty obvious. They don't, they qualify as having a working class job, but if you know anything who's is lucky enough to be in a construction union, they're not getting working class wages. They really shouldn't be categorized in that group. But by and large, poor people get hit harder than rich people. Color me shocked, Steve.
I have a question, John. Should I start snoring tomorrow or start snoring right now? You don't have to answer. President Biden plans to speak about the Omicron variant tomorrow, a White House official confirmed to CBS News. President Biden's speech comes as the nation sees a spike in COVID-19 cases. Building off his winter plan, the president will announce new steps the administration is taking to help communities in need of assistance, while also issuing a stark warning of what the winter will look like for Americans that choose to remain unvaccinated. Let me give a little comment. This time of year, of course, mid-December to mid-January, you have your school children, K through 12, are out of school, staying at home. You have your employees that are taking vacations. They're staying at home. You have very cold weather. And by the way, John, I don't know if you know, because you're in Munich, Germany. I woke up, it was literally 37 degrees this morning. I mean, it's probably warmed up to like 65, 70, whatever the case. But I'm waking up, getting in my car to work. It's 37 degrees, okay? You've got the cold, you got people off work, you got the kids home. People are staying inside. This is why it's called the cold and flu season. So I understand the warnings that are being put out by governments and the news and all that stuff. But, number one, if you're not vaccinated, you're an idiot. Get vaccinated. As far as gathering with people, John, you know me. I've been practicing the same social distancing now that I was practicing since Friday the 13th, March of last year, when the national emergency was declared. And I'm fully vaccinated. I'm not yet boosted. But I just because I got vaccinated doesn't mean I'm going to go to a football game with 70,000 other people or go to a concert indoors with thousands of people. No, I don't want to be around strangers yet. John, I'm going to say this for the first time. I don't think I've told you. I not only had the opportunity to go on a cruise, John, this past weekend, they were going to pay me $500 to go on the cruise. And that's no BS. Yes, my cruise line was going to pay me to go on the cruise. But you know what? Cruise ships have always been, even before COVID, quote, breeding grounds for disease, close quote. And you know what? It's not worth the risk for me, even if I'm going to get paid $500 to go on a cruise and be encapsulated with 2,000 other people, even though they require you to be vaccinated and they require you to have a negative COVID test within 48 hours to step on the ship. I still chose not to go because for me, it's not worth the risk. Now, will I reevaluate in 6 months? Absolutely, because I haven't been on a cruise in 2 years. And believe me, I want to cruise. John.
Okay, well, this last item is probably going to be the most controversial one I read. And it's all about free speech and anti-Semitism. It's from the Southern California News Group. Anti-Semitic COVID flyers found near California homes. Pasadena police are investigating after about 200 anti-Semitic flyers connecting COVID-19 to Jewish people were distributed to various parts of the city on Sunday morning, December 19. The flyers were thrown randomly on the street, sidewalks, and driveways of homes along Mentor, Catalina, Wilson, and Mar Vista Avenues, as well as Washington Boulevard in the Bungalow Heaven neighborhood, city spokeswoman Lisa Derderian said. Apparently, I mean, I can go on reading the article, but basically what it says it's a Jewish conspiracy. It's a bunch of nonsense, obviously, okay? It's obviously a bunch of excrement. It's stupid. Having said all that, why is anybody calling the cops? are calling the authorities. Apparently, this is certainly covered under the First Amendment. The only thing that happened was these flyers were put on the street. Nobody went banging on doorbells at 4 a.m. Nobody harassed anybody individually. They just, they found it was like having a throwaway paper. So, if we get to the point where, it doesn't matter if it's stupid and even untrue, you're allowed to publish it. I mean, now you can say it's group libel. Okay. Maybe you can go on that if you want. But by and large, I think, at this country, we're getting to the point where, you start restricting the people who are mad, people who are crazy or insane from saying whatever they want to say. Where do you draw the line? Basically, the courts have generally said it's a line you can't draw. It's so slippery. Once you start drawing that line, you end up in lots of trouble. So, get the flyer, laugh at it, throw it away, and go on. That's what I have to say about that.
This is, I believe, my last story of the show. From City News Service, Los Angeles County reported 3,512 new cases of COVID-19 yesterday, December 19, and 9 additional deaths associated with the virus, the third consecutive day with more than 3,000 new cases after months of lower totals. Despite the high number of cases, officials said that yesterday's emergency cases and deaths likely reflect reporting delays over the weekend. The number of Los Angeles County residents hospitalized with COVID-19 increased by just 1 to 743 Sunday, with 180 of those patients in intensive care. The same as Saturday's total, the county had 772 COVID patients on Thursday. John.
Okay. I'm fond of saying that the more I know academics, the more I like my plumber. And this is a story that goes along those lines. 4 California universities missed out on as much as $47 million in coronavirus aid. 4 California public universities could have received $47 million more in coronavirus aid if they sought funds from a different federal agency, a recent state audit found. As a result, some students may have missed out on support services and equipment during what has been an unprecedented disruption in schooling worldwide. California colleges could apply to 2 pots of money, one supplied by FEMA and the other by the U.S. Department of Ed, called the Higher Education Emergency Relief Fund, HERF. Of 6 University of California and Cal State University campuses audited, 4 used education funding, Department of Ed, for expenses where they should have asked FEMA for reimbursement. And the audit recommended that Chico State, Cal State Long Beach, UC Merced, and UC San Diego apply to FEMA for reimbursement of about $7.5 million in past expenses and $39.7 million in planned expenses, so they can use that money to support students. Now, these are universities. Aren't they supposed to have people who can read and write? And they're full of bureaucrats. Aren't they supposed to have people that know which one federal agency from another? I mean, come on, folks. And these people are, they're charging how much tuition to the same people who can't find the right agency to apply for funds, or teaching students? What are they teaching them? It just increases my saying that, the more I know academics, the more I like my plumber. At least the plumber does his job. Steve.
John, did you say the more you like your academics, the more you like your plumber? Is that what you said?
I said the more I know academics, the more I like my plumber.
Well, I know this, that the average plumber charges about $100 to $150 an hour. So that's $200,000 to $300,000 a year. There is no shame in being a plumber or an electrician, for that matter. Thank you very much for joining this edition of Work Comp Matters. We are brought to you by mancavepodcasting.com. If you want to do your own podcast, all you have to do is talk. We will manage it, stream it, get it on the air for you live, and then into the cloud forever. And I guess officially we have a new sponsor today. For those of you listeners, and I hope the judge is listening. Judge, if you're listening, take note of this, because you probably realize that for the past 2.5 months, I have not said that we are brought to you by Church and Law. That's because after after over 7 years, I am no longer with Turchin Law. In fact, as far as I know, Turchin Law is closed. I have joined another firm right across the street, and it is called the Nitka firm. So for the next 5 years, Steve Appel is doing workers' compensation, employment, and labor law with the Nitka firm on Van Nuys Boulevard, walking distance of the federal court, state court, criminal court, and of course the Workers' Compensation Appeals Board. And hopefully, if the stars align, this will be the last law firm that I ever worked for. I've worked for 2 in the past 13 years, and hopefully this is the last firm I ever worked for. But we just opened the office. This is our day 1. We are at 6315 Van Nuys Boulevard, 1 block from federal court, 2 blocks from the Workers' Compensation Appeals Board. And I very much hope that I can close out my career in workers' compensation with the Nitka firm. And yes, it is a career, not a job. That being said, I want to thank very much Scott Walton from Legendary Uncle Studios, John Scalia out in Munich, Germany, all the good people at mancavepodcasting.com, as well as the Nitka firm. My name is Steve Appel. We'll see you again live on Friday, 12 noon, for another edition of Work Comp Matters. Bye, everybody.